that are testifying. And we do have one big panel. So when that panel comes up, if you'll just come on, sit up in the chair here, and then we'll have the panel, and then we can ask that panel questions. So with that, first on the agenda, and let me recognize today, this meeting is being recorded. Monday, October the 16th, and the meeting is supposed to be from 12 o'clock to 2:30 p.m. I'm sure we're going to go over a little bit to 3 o'clock, and we are in the Lee Auditorium. Thank you very much to Chick-fil-A and the administration of Augusta University and Margie Miller. Where's Margie? Okay. We appreciate Augusta University for helping us put this meeting together. So with that, we're going to hear from the Medical Association of Georgia, Dr. Scott Bohlke. Did I say it correctly? You did. Good. Good. Thank you for coming. We appreciate it.
I was told to be right here, correct?
Yes.
All right.
That should be turned on.
I should be turned on. Thank you.
Yes.
I'm, as you mentioned, Dr. Scott Bohlke. I am a family physician in a small town of Brooklet, Georgia, which is about 1,200 people. And some of these students may be from the Bullitt County, Statesboro area, and they may know it well. I graduated here, so some 30 years ago, so this auditorium was still here. I've spent some time here, but it looks a lot better than it did when I was here. Did my residency in Columbus. I went to the Air Force for 4 years, and now I've been going on 19 years in Brooklet, Georgia as a family physician, solo physician. I have 2 nurse practitioners actually that work with me. I've been there, like I said, going on 19 years, and it is, and I think it's nice to see a physician in the rural area too as well here, and she would certainly agree. They're some of the most difficult patients to take care of because of the lack of resources, not only for them, but also the medical system itself. I am, and the psychiatrist, I am the rheumatologist, I am those type of physicians who are not in the area and take care of these patients and do the best we can. And sometimes that's all you can do, is do the best you can for these patients. They desire and they need so much more, but we do the best we can, and I'm certainly she would agree with me that it's very, very difficult. These patients, plus probably the inner city patients, are probably the most difficult patients to take care of because of that, because of the lack of the resources that they have, as well as the medical system. So currently, I believe in a team concept. Once again, I do employ 2 nurse practitioners. They are vital to what I do in my office, but certainly I am overseeing what they're doing on an ongoing basis, on a regular basis, on a daily basis. I told you, in this town of Brooklet, the practice has been in existence since 1956. So 60 plus years to this practice. And when I got there, almost 19 years ago, all the records were on 5x7 index cards. So we've gone from 5x7 index cards to regular charts now to electronic medical records, which I've been on since 2003. So it's so much difficult to do what we're doing now with all prior approvals, with getting medicines approved, getting CT scans approved. It's a very, very difficult situation to get things done when you only have one place to go to get these things done. It's extremely difficult because of all the additional requirement that we do that has not direct patient care. It's all I call it the hassle factor. It's so much more that we have to do. I always bring up the point where I had actually had to get a prior approval on a drug that costs $4 at Walmart. And it's a point where you almost want to give up because that cost me a lot more in my staff time to actually do the $4 prescription if they just took it and paid cash at Walmart. So we certainly laud the committee, and I appreciate the time to speak to you. I'm not going to be very brief. I actually saw patients this morning and turned around and going right back and seeing them this afternoon. So we certainly hope that I do sit on the physician workforce, which is now called the Georgia Healthcare Workforce. So I'm on that board, been on there for a year and a half or so, trying to do all we can to help the rural areas. So I've been actively involved in that, as well as the past president of the Medical Association of Georgia. So I learned from Dr. Bowler that was there that it was very active at the state level as well as the national level. So is very near and dear to me because I learned from the best. So I will stop there and accept any questions.
Is there any questions? What do you feel like is the role, what did the nurse practitioners do for you in your office?
They help, indeed help me take care of the patients. They are seeing follow-up patients for me. When they have questions, they come to me. So we have some very complex patients. When you have people, our older generation population, and certainly with obesity being as it is, we've got some very sick patients that come in our office. So they help me take care of them. They're getting things done outside the office, able to get those kind of things done, which is very, very important. As getting nutritionists, but we only have one nutritionist in the whole county, so that's very difficult to get patients seen by them. So they're able to assist us and do those kind of things too as well, which is very important because once again, we have limited resources.
What county is Brooklet in?
Bullock.
Bullock.
Mm-hmm.
Do they make rounds at the hospital with you?
No.
They don't. They're just office based.
Correct.
I say just office based. That's a big job in itself.
Correct.
What is the stance of the Medical Association of Georgia as far as the expansion of the APRNs in the state?
So we don't agree with independent practice, but certainly we agree with the team practice, the team concept, which I think with where healthcare is going with the ACOs and where payment models are going, we're going to the quality care versus quantity care. So I think this is just follows suit for that.
Mm-hmm. I had received some articles this weekend about the state of Oklahoma, and there was a senator there that was going to propose, I believe there, that APRNs are required to pay the supervising physician. You're probably familiar with this. And they were talking about one physician was paid $30,000 a year. And the purpose of the senator's bill was to negate the cost involved that seemed to be a hindrance in the rural areas, that the APRNs didn't feel like it was fair because there was very little supervision. What is your stance on that?
Stance on paying for that supervision?
Yeah, what do you think? Has the Medical Association taken in the House of Delegates, have they taken a vote on that? Or?
No, I believe we have not.
Is that because you don't agree with the expansion of the scope of practice, or you just haven't gotten that far?
I don't think we've gotten that far as what Oklahoma has done with the paying $30,000, but so no, we've not taken that up.
Has the House of Delegates taken a stance from the expansion of the scope of practice? Have they actually voted on it?
Once again, they've opposed it and are...
they voted on it?
I believe they, and Derek would probably, yes, we have.
They voted on it, that they're opposed to it?
Yeah.
Well, if they're opposed to that, what is their solution to the primary care docs in the rural areas to be able to deliver services to more people? What is the changing healthcare infrastructure? What is their solution to it if they're opposed to the people that are practicing and learning how to do different things in the state? What's the solution?
Well, I think, we could go on till 2:30, 3 o'clock if you wanted to on that answer, but it's very difficult. The solution is you pay the folks that are there, the physicians that are there, and hopefully with putting more physicians there and having their supervision with the nurse practitioners would be the solution. Once again, I sit on the physician, or now it's called the Healthcare Workforce Board, and that's what we're doing, and that's what we're shooting for. And matter of fact, I have a meeting here next week in the same, here in Augusta for that. But so I've always said I was once told if money's the answer, what's the question? It's about money. It's about paying folks to get them to do what they need to do out in the rural areas. It's, once again, when you're dealing with Medicare and Medicaid population, that's why some of these small rural hospitals are closing. They can't make it on just that type of payer mix. And in some of these counties, they don't have any other payer mix. So it's very difficult. I'm down to one exchange product in my county. And it's Blue Cross, and they may not be there next year come first of the year. So it makes it difficult for the patients too as well because they have very high deductibles. So I work in a practice where I don't take appointments. I'm a walk-in clinic 5 days a week. I'm there until I see the last patient after 6 o'clock. So, you know, I'm doing everything that I can to try to help access to care and take care of the folks. And I'm a lot cheaper than the emergency room, and I'm a lot cheaper than the urgent care. Okay? I don't think ER is the proper place to have their care. I think it's in a primary care's office, and it's with a team. And it's a team with folks with all the same, you know, goal and same desire to take care of these patients, which, once again, very, very difficult with their limited resources.
Do your nurse practitioners see patients when you're not in the office? Are they seeing patients now while you're here?
They do see some follow-ups, yes, ma'am. On a, you know, just a small scale-down model.
Would they not see a new patient if they walked in the door?
Not typically, no.
And is there a reason for that?
Because with insurance and other things that we required actually to see the patient initially, and then then the nurse practitioners are able to see them moving forward.
When the workforce board is meeting, what is the solution to recruiting students to go into the practice of medicine now? Because when I talk to students, they don't want to go into medicine because they see the changing to the single payer system, and they accumulate $300,000 in debt, and they get paid $140,000 when they get out.
Right.
What is the workforce looking at as a mechanism to attract them?
One thing really, and actually Mercer and Dr. Sumner, who's actually a former nurse practitioner, now actually a physician and now dean of the School of Medicine at Mercer, are doing something which they are actually nominating students as they go into medical school and fast-tracking them and actually getting them a residency all aligned before they even go through the match, which is, once again, at the end of the 3rd year of medical school, or right before they graduate in the 4th year. So they're already lining them up, getting them through a little bit quicker, getting them into a residency that's more designed for rural health care, and producing those kind of physicians to get them out there with substantially reduced debt, which is outstanding. I just read where here at MCG, or I was at a meeting last week, and it's I believe it's $28,000 a year here at MCG, and that's probably the most inexpensive one here in the whole state. When I attended, it was $3,600, and it's dramatically gone up. So helping them with the loan repayments, loan forgiveness, the Georgia Healthcare Workforce is able to give grants to these folks with a commitment of 3 years of service in that area. And what we've done actually is started going around and inspecting these practices to make sure that these physicians are doing what they're supposed to be doing, which is working in these areas.
Has the Medical Association taken a stance on the preceptorship? There was a bill last year about preceptorships. About
giving loan forgiveness a tax break for preceptorship. We were in favor of that. It was not hotly debated.
Okay. All right, we're just about finished with the time. Is there any other questions? Did anyone have any questions? Any other questions? Thank you very much.
Thank you.
Wait. I think Doctor has a question.
As you were talking, I apologize. I was kind of struck by your statement that younger doctors don't want single payer. My experience is, and I just looked up a survey, we're only down to, 19% oppose single payer. I think under a single payer system, people wouldn't come out with $200,000 and $300,000 of loans. It's the difference in the integrated system.
Okay. Thank you. We appreciate you coming.
I just want to ask one question, if I could.
Okay. One more question.
First of all, I wanted to thank you for your service to the community. I was raised in Scotland, Georgia, in Telfair County,
yes.
And I know exactly about those 3x5 cards all those years. But there's a lot of evidence that APRNs can do a lot more. They can see new patients, and I mean it's a preponderance of evidence. I'm just wondering, is the Medical Association of Georgia looking at the data as you have these discussions? Do you have some indication that it needs to stay the way it is in the state of Georgia?
Well, we certainly look at all the information and certainly understand those some studies. But I keep coming back to, when you mention the rural area, these are very difficult patients. I mean, they are, and they're difficult for me, and I've been doing this for 24, 25 years, and I can't imagine, a newly trained anybody, whether it be a physician or a nurse practitioner, taking care of some of the things that I take care of in my office and try to avoid actually them going into the hospital And that's one of my biggest rewards, I think, for the patients, is keeping them out of the hospital. That means I haven't done my job probably as good as I should have. The patient's not doing their job. So it's a very difficult. And these patients are very complex. And we're certainly with patient safety, you know, the whole adage, first do no harm. We don't want to, we want the best care for these patients. And I think a team approach is certainly the best way to do it.
What hospital do you refer to?
East Georgia Regional, which is in Statesboro. Mm-hmm.
How's it doing? How's the hospital doing, do you know?
Hospital's doing well, just been bought out by CHS, so it's a for-profit hospital and very expensive.
Okay, thank you.
Mm-hmm.
Safe travels home.